Memorial Hospital, Mumbai. And Dr. Saab, tell us what has been your session about and what this discussion is going around.
So hello everyone, I'm Dr. Nandani Menon. I'm a medical oncologist at Tata Memorial Center in Mumbai. So I predominantly work with patients in head and neck and lung cancers. So today at our 6th lung cancer masterclass. So basically this class, what we have it every year is for students, mainly trainees in medical oncology as well as practicing medical oncologists, to update ourselves, and it focuses on not only just the updates but on the very basics as well, that we get a good grounding. So the session that I want to speak about is our brain meds clinic, brain meds workshop. So we know that in lung cancer, brain metastasis, basically that is the spread of the disease from the lung to the brain, is quite common. It's a well-known fact, and the whole challenge about managing brain metastasis in lung cancer, it's a challenge because the occurrence of brain mets actually drastically worsens the patient's outcome and including the lifespan, especially in the past when we had less effective therapies, and chemotherapy generally doesn't go into the brain and tackle the disease so well. So people lived shorter if they had brain mets. But in the past 10 years or 15 years, with the advent of new drugs, that is targeted therapy, special drugs which actually are oral tablets but they'll have enough levels in the blood and in the brain and in the CSF, the outcomes or the lifespan of patients with brain metastasis or tumors of the lung spreading to the brain has actually changed a lot. So the whole idea of this workshop is to understand the nuances of managing brain mets. So it's not just, in the past we talked about brain mets in lung cancer, say bad prognosis, give radiation, patient is going to die anyway. Things have changed now because we know now there are driver mutations in lung cancer where brain mets are more common than non-driver mutated lung cancer. At the same time, these patients have access to good drugs. People who were dying like say in 8 months or 9 months now are able to live for 3 years, 4 years, 6 years. And in these patients, when brain mets are pretty common, like nearly 30 to 40% of them will develop brain mets or probably more over their lifetime, and they're going to live longer. When we used to do the older therapies of just radiating the brain or doing non-selective or the older radiation techniques, these actually had side effects and compromised the quality of life. So we know when patients are going to die quickly, we are not so concerned about delayed side effects because patients don't live long enough. But at this time point, when we have patients with good targeted drug living longer and almost a normal life, so managing those brain mets appropriately becomes important, because brain mets now doesn't mean that like a death sentence. It means that if you manage them properly, patients can live as much and as well as possible. So today's brain mets workshop had 4 parts. We had a short session, but we had 4 important sessions where we had our radiologist from Tata Memorial, Dr. Arpita Sahu. She discussed on how we look at MRI images, how we identify brain mets, what are the nuances on MRI, rare scenarios of sometimes diagnostic dilemmas, like sometimes the mets on the scan can appear like something else, and how do we diagnose them? Because you know that every time something is in the brain, it's not suitable for us to go and operate and take a biopsy. The situation with things in the brain are quite different from outside. So that was what was discussed. Then we had a neurosurgeon, Dr. Prakash Shetty. He is a convener of our neuro-oncology disease management group and he's a professor in neurosurgery at Tata Memorial. He spoke about how we basically approach as a surgical approach to patients with brain mets. So do we, like sometimes people don't want to touch or neurosurgeons are hesitant to operate. So do we offer surgery? Which patients are good candidates for surgery? Like how do you select the patients who will benefit and live longer by operating surgery? Which patients you should not operate? Because anyway the disease is so bad that operating them might not really change the outcome. So that was what was discussed. Then we had radiation. We had Dr. Bhavin Visaria, who discussed lots of new things about radiation, including stereotactic radiosurgery or stereotactic radiotherapy, which is a new, not new, but it's like it's been there for a while, but it's one of the better techniques. Better techniques to give radiation to the brain without causing too much of damage to the uninvolved areas of the brain, so that the patients don't get something what we call as radiation necrosis, or even effect on the parts of the brain where again it can affect your cognition. Cognition basically it's how you think and how you basically your intelligence and your quality of life, and preserve it for us as much as possible. So these newer techniques, they try to let us achieve that. And also most important is also we discuss in which patients you don't treat the brain mets.
Okay.
So like whether you have something like an EGFR or an ALK mutation where the patient has access to a very good drug that can go into the brain, and he has small brain mets with no symptoms. Maybe you don't need to subject that patient to a major surgery where you're opening the skull and operating the brain met, or giving him radiation which has long-term impact. So those things were also discussed. So this whole idea of this workshop, it was started by Dr. Vijay Patil in all these past 5 years, and every year we have it, is to its challenges. And the thing is, when we organize, we learn more things. We also learn that people in other centers are also doing basically molecular research in the brain metastasis to see how to treat the patients. Like when you have brain mets, they get treated, they recur again. So then people try to get those tissue out, do analysis, and then treat according to them. So a lot of advances are happening in the field of brain mets. Things are, I mean, it's not a great thing to have, but things are not as dismal as it was in the past. So this is the update about the brain mets workshop that we had at this.
That's awesome. You not only have given the update, you have given a lot of hope and positivity to all our viewers and me. And this was Dr. Nandani Menon, medical oncologist from TMC Mumbai, and with me Vivek Sharma, social entrepreneur. See you.